A very good evening to all of you. Myself, Dr. Prateek Garg. Today we will discuss about fractures in face, or we can say in nose. So let's start. The most common fracture of the face is nasal bone fracture. So it has been asked previously. So most common fracture of the face is nasal bone fracture. Then comes the chevalate fracture. Suppose the mode of injury or the impact of injury from below. So look out at this arrow. If the impact is from below, so what happens? There will be the fracture line which is almost vertical. Vertical in the cartilaginous part of the ethmoidal bone, leading to a vertical septal fracture. But usually there is no deformity. So in that fracture, what we can do, once the edema is settled, that is after 1 week, we can do the close reduction. If suppose 3 weeks or more than 3 weeks has been passed, then we can do the septoplasty. So this is chevalate fracture. Then comes a Jurjeve fracture. So in Jurjeve fracture, the mode or the impact of injury is from the front, blow from the front. So if suppose hit is like this over the front, so what happened? There will be horizontal, or we can say along the angle or axis of the ethmoidal plate, or we can say cartilage. So fracture line will be like this, as you can see here. So there will be horizontal fracture with deformity. Why deformity? Because if horizontal fracture is there, so nasal bridge may get little bit depressed. So in this fracture also, after 1 week, that is if edema is subside, then we can go for the close reduction. And suppose if there 3 or 4 weeks gap is there already passed, then we can do the septoplasty. So try to remember chevalate SC comes first, so impact is from below. B and C. How I remember? So from impact is from below, then comes the chevalate. So B and C. And if Jurjeve, that means impact is from front. So it comes after, so blow from the front. Then comes the naso-orbito-ethmoidal fracture. Suppose in road traffic accident or high velocity, patient fall from the bike. If bike is in high speed, may get injured in the road traffic accident. So what happens? There will be the fracture of the nasal bone, orbital bone, and also ethmoidal bones. So patient will have a pig nose. That means there will be collection of the blood into the nasal part in the subacute part of the nose, leading to an edematous nose, which is known as pig-like nose. There will be fracture of the perpendicular plate of ethmoid. Generally in this fracture, there are so high velocity fractures are there. So there will be a perpendicular plate of ethmoid will get crushed. There may happen the CSF leak because cribriform plate, the impact may get transferred up to the level of the cribriform plate, leading to CSF leak. So in this type of fractures, we have to do the open reduction of the fracture. Other one is zygomatic bone fracture, and this is tripod. We all know this is the zygomatic bone which is giving the malar prominence here. So it is attached to 3 parts. One is the maxilla, then comes the frontal, temporal. So like this. So if this tripod fracture, so all around zygoma fracture is there, which happens usually because of direct blow, like in the boxers. We do the boxing, some sort of fight, we do dishum and all that. So hit over the zygoma. So if this tripod fracture happens, what? So this may lead to infraorbital nerve injury. There may be the flattened malar eminence. This is a malar eminence, and it may get flattened. There may be trismus or diplopia. Patient will try to open his mouth, he will feel the pain. He can't open mouth properly. There may be diplopia because if the orbital fracture is there because of the zygoma or something happens. So the rectus muscle, inferior rectus or inferior oblique, their function will get impaired, leading to diplopia. There may be the subacute emphysema. So in these type of fracture also, we do the open reduction and just fix that reduction part. So in most of the facial injury, so the ideal time to do the fracture reduction is after 1 week when the edema settle down. Now there occurs the Lee-Ford fracture. So again, and has been asked multiple times. These are Leaford was a scientist which divided the facial fractures into three types: type 1, type 2, type 3. So look at this type 1. This fracture line is going like this. So it is involving the maxilla bone. This is my maxilla bone. The palate is involved. The floor of the nose is involved. So basically this is a transverse fracture, which is also known as urine fracture. Then comes the type 2 Leaford fracture, where the fracture lines, as you can see, is running at the level of maxilla bone, then floor of the nose, then comes the nasal bone, then again the lacrimal bone, floor of the nose, then comes the maxilla. So it is a pyramid shaped fracture line, so which is known as the pyramidal Leaford fracture. And the third one is the craniofacial dysfunction. Why this is craniofacial dysfunction? Because the fracture line is going through the zygomatic bone, then the bones of the orbit, or we can say the sphenoidal bone is involved, then comes the nasal bone, frontal bone, so multiple bone. See, this is above to this is the cranium, and below to that is the face. So type 3 Leaford fracture is also known as craniofacial disjunction. That means separating the cranial cavity and the facial bones. And these type 2 and type 3 both fractures may lead to CSF leak, because the fracture line is running at the level of the nasal bone, or we can say at the level of the ethmoidal bone. So that may result in CSF rhinorrhea. So try to remember this diagram if any time examiner want to ask between the type 1, type 2, type 3 Leaford fracture. If you remember this diagram, how this fracture line are running, you can answer them properly. What are the bones involved and how this will impact. Now there occurs the blowout fracture of the orbit. So basically in broad fracture, whenever you got patient get hit over the eye, we see a dark circle or ecchymosis below the eye. And sometimes what happens, the floor and the medial wall of the orbit will get fractured, leading to loosening up of the orbital content downwards or medially. Because if there is a fracture in the floor, so fat may get down through that fracture, or sometimes the muscles like inferior rectus muscle, inferior oblique muscle, these may get entrapped in the fracture line, leading to diplopia. Okay. So what will be the clinical feature? There will be restricted upward gaze because inferior muscles got entrapped. So there will be restricted upward gaze. There will be inophthalmos. Eye will get a little bit inside because of the fracture. There may be diplopia, and there may be infraorbital nerve injury leading to infraorbital region anesthesia. And one of the signs which is seen here is teardrop sign. It is usually seen in the X-rays or CT scan. What is teardrop sign? Suppose this is my floor of the orbit, and suppose fracture line happens here. So what will happen? Orbital content. These orbital content will go below by means of this fracture line, leading to appearance like a teardrop. How the teardrop? Suppose this is my teardrop, so it will give an appearance like that. So this teardrop sign, it has been asked in the exam, usually happens in this blowout fracture when the orbital contents, they just go downwards through that fracture deformity. So we can do the force duction test to check for the entrapment of the muscles. Now some other important examination point. What is the most common site of mandibular fracture? That is subcondyle. So most common site of mandibular fracture is subcondyle, not this symphysis menti. What is the guardsman fracture? The one man guard was the guardsman fracture by means of the guard. So what happens if the patient fall on the chin at the level of this level? So there will be fracture of symphysis menti and the condyles of the mandible. So this is guardsman fracture. Again,